Is This Normal, Doc? A podcast sponsored by Tanner Clinic. Disclaimer: the information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal healthcare provider. Welcome to Is This Normal, Doc? The podcast where we talk about what's normal and what's not, with help from our Tanner Clinic providers. My name is Hope, and I am your host. I am part of the marketing team. We have Tara joining me today. She is the co-host. Tara, who are you?
I'm the marketing manager here at Tanner Clinic.
Yeah, she's my boss, so we have to be on our best behavior. So in this episode, we are going to be diving into all things dermatology. We have Dr. Matt Innes here with us today. If you would like to submit a question for any of our future episodes, just make sure that you're following us on our social medias and we can get your questions from there. I just want to thank you for coming.
Yeah.
And being here and taking time out of your day to come and talk with us and help educate us on things that may be normal or not. Before we get into the questions, I wanted to give you the opportunity to kind of introduce yourself,
Sure.
Your work here at Tanner Clinic, what you do, and how you got here. What kind of got you into dermatology?
Thanks. So I'm Dr. Innes. I've been here for 5 years doing dermatology, and I started out thinking I was going to do a lot of cosmetics, actually, and I've since totally gone away from cosmetics. I'm just doing medical dermatology and surgical dermatology, so anything skin related. I mean, general dermatology, I do everything skin related. So any skin condition, I'm happy to see. And then we do a lot of surgical procedures too. So skin cancer removal, first of all, lipomas, cysts. I'm doing a split earlobe today. Doing a surgery for something called hidradenitis today, which is like an inflammatory acne in the body fold. So we do a pretty good variety. But yeah, anything skin related, I'm your guy.
We have some questions that were either submitted by patients or honestly, we have questions. You know, the nice thing about doing our job and being in a medical facility, being marketing, is that we get access to free healthcare information. So we definitely use that to our advantage at times. So I have a family member that's maybe not so smart when it comes to like sun protection. And every once in a while they'll come to me and they'll be like, does this look weird to you? And I'm like, yeah, you should definitely go get that seen. That's happened multiple times and they have gone in and each time it's been fine. But my question is, what types of things should people be looking for as far as like a mole or like a skin change? What type of warning signs should we be looking at on our skin to be like, oh, I should probably go in and have that checked out?
That's a good question. It's probably the most applicable question to the general public, so good one to start with. I do skin checks all day long, and so my patients are asking me that question all day, every day.
Yeah.
First of all, let me start with a couple of things that are normal. Cherry angiomas and seborrheic keratoses are something that pretty much everyone has. So cherry angiomas are the little red spots that, I don't know if you have any, but pretty much everyone does. So these tiny little, these tiny little,
I do.
these tiny little red spots, they can be flat, they can be raised.
Yeah.
These are totally normal. And usually you have several of them. We don't have a great answer for what causes them. People ask me, why do I get these? I just say, part of being human. So that one's normal. Seborrheic keratoses, these are also really common. You get more as you age. These tend to be kind of tan. They can be skin-colored tan or brown. They can have a variety of appearances, but they tend to be tan, and you can get them on your face, on your scalp. People get a lot on their back. People get them around their neck. Here's the main thing, though, that I tell people on what you're looking for.
Okay.
If you have several growths that look similar, that's reassuring. You're not going to get 20 skin cancers at once. So if you've got a bunch of spots that look the same, like your freckles,
Thank you. It's a freckle, guys.
Then that's reassuring, right? So I tell people, look for something that makes you suspicious because it's acting funny. If you've got a bunch of moles, but one day you look and you see a mole and you're like, that one did not used to be that color or size or shape, then come in and get it checked out.
Okay.
It's pretty common for someone to come in for a spot that looks suspicious to them, and I tell them it's fine, and they're like, sorry to waste your time. I mean, I get it, and it might feel like a waste of time, but I'll tell you about one patient I had a few months ago who had what we call an amelanotic melanoma. That was a melanoma that did not look like a melanoma. It looked like a patch of eczema, to be honest. Mm-hmm. I biopsied because he said it was acting different than his other spots, and I'm glad I did because it ended up being a melanoma.
Yeah.
But they don't have to be brown. They don't have to follow the traditional, you may have heard of the ABCDE of melanoma. I don't think that's practical for the average person. You know, so asymmetry, border, color, diameter, evolution, you know, are you going to remember the specific criteria for those and say...
Well, I'm glad you said that because I had no idea what the ABCDE was, so thank you.
Now you know, and now you can forget it because I don't think it's important for my patients.
Oh, okay.
I think what you're looking for is the last one, E, is evolution, changing. A skin cancer is going to change. So I sometimes have a patient who comes in and they're like, well, I had this spot and yesterday I scratched it off. A couple of days ago, I had a lady who brought...
Don't do that.
I had a patient who brought her seborrheic keratosis in a sandwich bag.
Delicious. Oh, that's fun.
So, for example, she's like, I this one peeled off. I mean, if it peels off, it's not a skin cancer.
Oh.
And so if you've got a spot that's kind of coming and going, that's reassuring. Anyway, to boil it down, you're looking for a spot that you notice is different than the others or different than it used to be. And I think that makes it simple for the average person. You don't need to remember specific criteria. If you've got a spot that makes you suspicious, you don't want to be the person who reassures yourself for 3 years and then comes in because it's really weird looking and it's that melanoma.
Yeah.
Yeah.
And they should be coming every year at what age do you think to come and get those?
Yeah, there's no
exams?
hard and fast rule. If you've got a family history of skin cancer, if you've had a lot of bad sunburns, I suppose those are some risk factors that would make you want to come in for at least a baseline. And then I can tell you,
if you grew up in the 90s and went to tanning because that was a thing we did.
That's right. Or even older than that, and baby oil. Tinfoil.
I've been told I am fine because I'm not of that generation and I also don't go outside. So I think I'm okay. I haven't noticed any weird changes in my skin, but...
This skin chick right here looks great. Yeah.
I try.
Yeah.
Okay, so I'm of a certain age where, you know, your hair starts thinning. It could be maybe genetics. It could be stress, nutrition, right? So is it just my age that I need to worry about my hair thinning? Is it my genetics, or is there something I can actually do to help my hair from thinning like it was? Also, maybe 2020, COVID, things like that maybe caused your hair to thin. Help us out with that.
Yeah. I mean, hair loss is like a universal worry, especially for women.
Yeah.
And a lot of us men. So it's a good question. I do think there are some families that have a genetic predisposition to just get thin.
Yes.
And
I'm there.
You might even call that like a normal variant, an unfortunate normal variant that kind of runs in the family, and there's only so much you can do about that. So I think some people just get thin over time. Minoxidil Rogaine is a medication that you've probably heard of, and that just helps the hair to grow. It helps the hairs to be in the growth phase. It helps to thicken them up. So that's something that can be used for anyone whose hair is more thin than they want it to be. But I do think that there's this kind of genetic hair loss that's not really pathologic, so to speak. And that one kind of is what it is. But as for a couple other things that would be worth knowing if it's normal or not. Telogen effluvium is a type of hair loss. It's a weird name because it's a totally made up term. Telogen effluvium. Telogen refers to, so this condition is where you suddenly lose your hair.
Okay.
This is a condition that's easy to diagnose if my patient is able to tell me this is when I started shedding.
Yeah.
If they are able to pinpoint like middle of September I started shedding, it's telogen effluvium. And you notice typically you're in the shower and you're like, whoa, that is a lot more hair in my fingers than I'm used to, or in my brush. Telogen effluvium is kind of an interesting one. It's triggered by something. And a lot of the time we're able to pinpoint the trigger. So it happens 1 to 4 months after the trigger. I saw this all the time during COVID, about a month after COVID, and it was usually like the type of COVID that got you sick and made you feverish. A month later, these people would just start shedding like crazy. Yeah. Telogen effluvium, while it is really stressful to have because you think you're going to go bald, you're not. Not all of your hair goes into this telogen, which is the shedding phase of the hair.
That's good.
We want the hair to be in the growth phase. Most of the hair is in the growth phase, but in telogen effluvium, a lot more hairs than normal go into the resting shedding phase. But it is self-limited. And so you go through this, 6 to 8 month course of shedding, it peaks, shedding goes back to normal, and then the hair regrows. So that's a type that if you suddenly notice shedding, come in, and we'll see if we can find the trigger.
Yeah.
If we can't pinpoint an obvious trigger like, postpartum, COVID, a major illness or a major stress or things like that, then sometimes there's some labs that we check to see if iron's low, thyroid, things like that would be triggering kind of an ongoing shedding. And then male and female pattern hair loss would be the most common. That's obviously what I have, but females can get it too. And so if there's accentuation up here, for both males and females, it's that you get thinner up here than around here.
Right.
That also has some kind of genetic underpinnings, but it's more of a hormonal thing and we've got pretty good treatments for that. So, dermatologist.
So there's hope is what you're saying.
There is
hope. Good, because my part is getting a little bit wider up there. So
there is hope, and I think a lot of people don't realize that dermatologists are hair specialists as well. And by the way, nail specialists. I think people don't know that there are nail specialists, but
there you go.
Skin, hair, and nails, we do it.
That is really good to know.
Yeah.
I remember growing up and seeing like all the beauty influencers always do like DIY skincare, and they'd be like, make your own face mask. Or like, remember when coconut oil was like a big thing? Everyone was like, coconut oil for everything in your hair, on your skin, whatever. I just wanted to know your thoughts on if you think that natural and DIY like skincare is as effective or can be as effective as store-bought or, manufactured skincare. Just because I think a lot of people probably still lean towards that because there is like a push in natural skin, natural eating, things like that. People are really into that, or just budgetary reasons because some skincare is really expensive, I think. Yeah. So what are your thoughts on that?
Well, I'll break my answer into 2 sections. So DIY versus natural are kind of 2 different topics to me.
Yeah.
DIY, absolutely keep doing it because I love hearing these stupid trends. It's awesome. Like potatoes on your face is definitely going to work. I love the TikTok trends. No, I mean, DIY stuff probably isn't going to be very effective. But also probably. But I do like hearing the trends. So, I mean, DIY gets a little more risky, although it's still probably not all that harmful to try. But if you're mixing stuff together that can be irritating, gets me a little worried.
Yeah.
But in general, go ahead and try them.
I feel like there's like a sugar scrub one where it was like a lemon and you put sugar on it. That makes me want to cry. So I have such sensitive skin. I was like, not going to be trying that one.
You're going to talk about my website in a minute, and I'm the Frugal Derm, but I haven't posted for a couple of years. I'll get back to it when my twins get a little less crazy.
You just had twins, everyone. Congratulations, but yes, there you go.
That's why I'm not posting.
You get a pass for a while.
Okay, so the whole concept I created that social media presence for was I think that there is a huge need and a huge want for people to know, is the expensive stuff worth it?
Yeah. Yes.
And I am a product minimalist. I think that in general, the answer is no. I mean, I would never buy a skincare product for over $100 because, the stuff you find at the store, CeraVe, Cetaphil, Neutrogena, Olay, I really like La Roche-Posay. I mean, these companies have tons of money too. I mean, these companies are worth a lot of money and they have a lot of money to spend on research and development.
Right.
And these products are awesome. So I'm not calling people who buy expensive products gullible, but it's not worth it for me. I think the marginal difference between a a grocery store product and the expensive products you're going to get is just the marginal benefit is not worth the price tag.
Like
to
how
me.
much more can you get for $50 more, you know?
Exactly.
Like what is worth $50 more to put
I
in
think
your
there
skin?
are a small handful of products like SkinCeuticals makes this $150 CE ferulic.
Mm-hmm.
Vitamin C is a finicky molecule that needs to be stabilized by ferulic acid. You could argue that that's one that you're going to get a lot more benefit out of that than the drugstore brand, but I think those examples are few and far between.
Yeah.
So, anyway,
Like
I wanted-
retinol products. I know they're get a little pricey, but do you recommend that?
Yeah, so I think
one worth it?
I think when it comes to retinols, you're basically deciding whether you want to do an over-the-counter strength or a prescription strength.
Okay.
And so to me, I think plenty of brands make a really good, like adapalene gel, which was prescription only until a few years ago. And then Differin is the brand that came out with the first over-the-counter. Now there's like, I think 5 or 6, maybe more brands that make adapalene gel. I really like La Roche-Posay as a brand, but I mean, Neutrogena makes it now. And I would argue that I tell my patients I'm fine with any of the brands. So I don't have a strong preference. Adapalene, if you wanted to get a prescription strength, but over-the-counter retinol, adapalene's a great one to go with. I don't have a strong preference on brand. My patients ask me, like, am I okay to keep using this? I usually say I'm fine with it because my only concern is it something that's really irritating? And for example, if I'm treating acne and I'm prescribing something that I'm obviously prescribing the active ingredients that I think the patient needs.
Yeah.
So if you want to keep using your own products because you really want to use something that's organic and natural, in general, I'm fine with it. But my products are going to be a little bit irritating. And if you're also using products that are a little bit irritating, I don't want you to get too irritated and not be able to tolerate my products because I'm prescribing what I think you need. But for the average person who just is a little leery of traditional medicine, chemicals, wants to go organic and more natural products, I think it's totally fine. But let me give you an example.
Okay.
Pumpkin seed oil has anti-androgenic properties and can be used to treat androgenic alopecia, male and female pattern hair loss.
Mm-hmm.
The only time I would recommend it is someone who wants to be organic and doesn't want to take a medicine, because finasteride is a medicine I take for male pattern hair loss, and it does the exact same thing, same mechanism, but a lot better. And we know more about it, and we've studied it more.
Mm-hmm.
So there are some people who just want to use something organic, and sure, use pumpkin seed oil. That's totally fine. If you want something that we know more about and have studied dosage and does the same thing but is better, then I'll give you the medicine version. For topicals, like a lot of people love their essential oils. My only problem is that all the evidence behind it is anecdotal. I mean, obviously, Eastern medicine has used these ingredients for a lot of years for a lot of different things, and I'm not saying there's no evidence behind it. These essential oil ingredients certainly have medicinal properties, but these days, it's mostly just marketed by the companies that produce it, and they say it does this, that, and that, and that, and everything. And that's when I get a little skeptical, because there's no way that
You're like, it's too good to be true at this point.
there's no way that
Can't do
lavender
all
oil.
of that.
There's no way lavender oil does all 14 things that they claim it does.
Mostly gives me a headache.
I love lavender oil.
So, yeah, it's more expensive and less accessible to come see a dermatologist. So I really, the skin is durable. You can try most things with little repercussion, but I think our personalized recommendations are obviously going to be a little more strong and effective than the average over-the-counter stuff.
Yeah.
So what you're saying is, if you have questions, make an appointment, and then you can find out what's specifically good for you. Right. Right. All right. So before we finish, I kind of want to know, do you have a story of maybe a patient that came in and kind of had maybe a not so normal diagnosis that you want to share with us?
I'm going to quickly go through just a couple.
Okay.
Okay, so I had a teenage boy who had recently gone on a senior trip to, I think it was Costa Rica, and he had what looked like an abscess, like a raised kind of boil on his leg.
Ouch.
but it wasn't red or inflamed.
Already itching.
You already know you're gonna have
I can feel what it is.
So it wasn't behaving like an abscess. And so I'm like, well, let's numb it up and let's see what we're dealing with here. And as I start numbing, I see something move.
I was waiting for it. It's like, it's going to start moving.
I see something move. And what's funny is this was a teenage
my
boy. And
worst
I'm like,
nightmare.
I think there's something living in there. And he's like, let's go. He was so excited.
A teenage girl would have been screaming, or a grown, or me.
So it was a botfly larva. And these can get, when you're in Central South America and they lay their eggs on your clothes and then they burrow under your skin. And so,
Delicious.
so anyway, I think this is on my Instagram on the Frugal Derm.
Yeah.
I think it's one of my early videos where you can see me just pull this botfly larva out. That was a fun
We're
one.
going to go check that out right after.
Yeah.
And I didn't need to send it in for pathology. And he's like, can I keep this and show my friends? So we put it in a formalin cup and
There you
showed his
go.
friends.
I love it.
A couple other interesting cases. We had a lady a few months ago who had what we call flagellate dermatitis. And so it looks like a bunch of streaks on her back.
Okay.
And I just remembered from a textbook that you can get it from shiitake mushrooms. And I was like, this is a long shot, weird question, but did you by chance eat any shiitake mushrooms? And she's like, well, my mushrooms were about to expire, so I just cooked them all up last night and ate them.
Oh.
So you get this weird, this very distinctive pattern where it's just like a bunch of streaks on your back. And
Okay.
I remembered that I read in a textbook one time.
yeah, exactly. I thought it was a long, but I love when you just pull this random thing out of like she's like, why would you be asking me about shiitake mushrooms? But
You're like the
makes
real
you look like a
house.
genius. It's awesome.
I never would have ever guessed that mushrooms could do that. They do a lot of things.
There's this interesting rash called phytophotodermatitis.
Okay.
Phyto is plant, photo is sun, dermatitis is rash. And so it's often from limes. But what happens is when I think it's like furocoumarin is the chemical that's photosensitive. So when it's exposed to sun, then it changes the composition and it makes it more irritating. And so the weird thing is you get these weird patterns of rash. Like when we went to Mexico with some friends a few years ago and she had fingerprints on her arm. And then I often see it like drip marks. You can see like this weird pattern rash and you can see like linear streaks from the drip marks. It's another one I love because it makes me look so smart because I'm like, did you by chance go to a beach and did you by chance eat any limes there? And this kid's like, I love limes. And I had a whole bag there.
So what you're saying is, in the summer when you're going to Fizz and getting those limes, just don't go outside with.
Yeah, exactly. The last one I wanted to mention was a guy who had what we call allergic contact dermatitis, allergic eczema. TMI, you get this around the rectum.
Okay.
So when you get itchy around the rectum, I always ask the question, do you drink a lot of soda? I kind of ask about foods that contain a certain chemical. This guy
Sounding
came
familiar, Tara?
This guy.
she did that. She had to do a flyer on that.
Oh,
Or at one of our doctors.
yes. I was like, what are you talking about?
I'm going to tell your house.
Just telling all
It's
my.
not a personal thing. It was
Yes,
just for
so
work.
I did a flyer on. I'm gonna say it wrong. Puritas anus, I think.
Yeah, pruritus anus.
Right. Thank you.
He
Yes.
knows how to say it.
Yeah.
We're just marketing.
Clearly, we're in marketing.
We
I
ain't go to
gotta
med
spell
school.
it, but yes, I made a brochure for that one day. It was a great day.
So yes, pruritus anus.
Thank you.
What this guy was presenting with. And he's like, Doc, I think I'm allergic to sugar because every time I drink Mountain Dew Code Red and eat Arby's sauce. I mixed that story
good
up. I mixed that story up because he came in saying I'm allergic to sugar. I feel like when I eat sugary things, this gets worse. I patch tested him, and he was allergic to balsam of Peru, which is this fragranced flavored molecule that's in dark colas, especially Dr. Pepper. It's in tomato sauces, and it's in some citrusy things and some spices. And so once we did the patch testing, we were able to narrow it down, and we found out it was his Mountain Dew Code Red
Okay.
and the Arby's sauce.
And the Arby's sauce combined.
That's what'll get you.
And every time he eats those.
like
But I thought it was funny because he was
Giant
like,
Coke
I'm
and
allergic
Mentos
to
every time.
Yeah, exactly. Don't mix those two.
Don't mix those
I thought it was funny because he thought he was allergic to sugar, and we were able to figure out. But that's a condition where Well, you ingest food containing that, and that's where it comes out. So that's where you get itchy. But we found out it was his Arby's sauce and his Code Red. So
There you go. We know now the two combinations not to put together. Do not mix.
yeah, I thought
Probably
those
shouldn't
were-
mix for anyone. You can probably get away with it, some people, but maybe just.
It's all right. And if you do have an issue, I got a brochure for it. So
Yes,
We
Eric can fix you. I thought those were a couple of fun cases.
yeah, I love that. Thank you for sharing those. Okay, so clearly we've talked about my freckles. So yes, I have to use a lot of sunscreen. And yes, I grew up in the 90s where I wasn't using sunscreen. I was going to the tanning bed. So can you give us some recommendations on what SPF we need to be using? You know, if I work indoors all day, do I need to have the SPF in my moisturizer? Tell us about our sunscreen uses that we should be doing today.
I'll give you my concise bullet point recommendations.
Okay.
More important than the number SPF you're using is how often you reapply. And to be completely honest, when my patients come in and they're like, I used sunscreen, I still got sunburn. My sunscreen didn't work. I'm like, BS. I use, like, my favorite sunscreen is this Equate Sport that I got at Walmart.
Yeah.
Cheapest stuff you can get because it comes in a huge bottle and it's got a pump top, which I've got 6 kids, and so it's convenient.
Yeah.
Cheap
It's a lot
stuff.
of lathering. That's
It's
a lot
of lathering. I
Yeah.
start with the palest ones first. And so I use the cheap stuff. I know it works. I use it on myself. I burn easily. I know it works. It's about how often you reapply.
Okay.
I'm fair skinned and I burn really quickly. And so I love boating. When I'm out boating, my wife still makes fun of me. But I'm reapplying like every hour.
Okay.
And I'm convinced that I could use like SPF 5 and still not burn.
As long as you're reapplying more.
Yeah.
Is there a difference between the spray, the lotion, and then like, you know, the ones with zinc in it, let's say, you know, where you end up being white like a ghost, but is there
There
a
are
difference?
differences,
Okay.
but not terribly important. I would just say the most important things you need to know are, yes, the higher the SPF, the better. That is important to say. The higher the SPF, the more protection you're getting, but more important is just how often you reapply. I use the sprays. I use the lotions. I personally don't love the mineral sunscreens with titanium and zinc just because I'm already pale and they don't rub in well.
They do not.
And so there are a few that rub in much better, but in
Right.
general, even the sheer stuff doesn't rub in awesome. Technically, there are some advantages to those, especially if you do want to use fewer chemicals. Sure, go with a mineral
Right.
sunscreen. That's
I was
great.
trying to save the turtles. That is why I bought that
Exactly.
one.
There was
Yes.
that whole thing where it's like, if you use
Yes.
mineral sunscreen, you're killing
the turtles.
Yeah. The chemical sunscreen just rubs in better. And then my last recommendations on sunscreen is use a facial moisturizer that contains SPF.
Okay.
And I think most women use a moisturizer. I think most men don't. But they should probably start because here's the thing. Photo aging is such a real thing. I don't know if you've seen that photo of this guy who was a trucker and the side of his face is
right.
exposed to the light through the window
Right.
over the years is like so many more wrinkles than the other side.
Yeah.
So even if my patients aren't really thinking about skin cancer, photo aging and wrinkles
Yeah.
should be enough to make you wear your sunscreen. And if you're just relying on, okay, I got to remember to put on my sunscreen before I'm going to be out. Well, there are plenty of times where you're out for a lot longer than you expect.
You're right.
And you get a lot of light. I mean, I am indoors all day, but I'm going to wear a moisturizer anyway. I'm dry anyway. Might as well wear one that contains SPF.
Just in case.
And that way, my total hours of sun exposure I get over my lifetime is cut way down because I've just got SPF on my face without having to remember, okay, I got to put sunscreen on before I leave. The one I'm using now is a Neutrogena Hydro Boost with SPF. And it's a good one. Rubs in well. I like the texture. There are plenty of good moisturizers that contain SPF. But even if you don't wear a moisturizer, I think you should start because I think that's the easiest way to prevent photo aging. Like number one, I think it's a little bit silly that people get way down the rabbit hole with anti-aging stuff.
Yeah.
When they're not really consistent about sunscreen
Sunscreen.
because you're going to get a lot more bang for your buck wearing a moisturizer with SPF daily on your face than any combo of retinols and vitamin C and everything.
More sunscreen, less Botox is what you're saying. So
Yeah,
it's gonna
exactly.
even out if we use more sunscreen now, we don't have to pay for as much Botox.
That's exactly right.
It's a money saving. I love it.
Thank you so much. We appreciate you coming on, sharing your wonderful words of advice and your knowledge. You're basically the house of dermatology. But if you, once again, want to follow us on this Is This Normal Doc journey, be sure to follow us on our social media. We will be having other providers on here from different specialties, and they may be something that you have genuine questions about. So please follow us. Follow Dr. Innes on his social media and his website, the
We'll start
Frugal
posting
Derm.
again, I promise.
The Frugal Derm.
But what he has on there now on his social media is really informative and educational. So you can go now and look at the videos that he had years ago, still relevant information, right?
And the website, thefrugalderm.com, has Dr. Innes' favorite recommendations, product recommendations or something. And I've got broken down by category.
I was actually looking at this last night. It's super helpful.
Yeah, so,
love it.
like acne or anti-aging, I've kind of got, I'm not even making any money on it, no affiliate links.
Yet open to it.
But if you can help me, I'll make some money on it. We'd awesome,
Try.
yes. But yeah, I've got my product recommendations on there.
Yeah, it's awesome. So go follow him on his accounts for some great tips because he's going to start posting again, he said.
Yes, he is.
So are you currently seeing patients at this time, like accepting new patients?
Yes.
Perfect.
Yep.
So if you want to schedule an appointment with him, you can call our appointment line and you can schedule an appointment with him because obviously from what you've seen today, he is very knowledgeable and he can help you make your skin that much better.
Hair and nails.
Hair
That's
and
right.
nails as
Hair and
well.
nails.
I
Hair
just
and
learned
nails.
that. Thank you once
Thank you.
again.
Thanks.
This has been Is This Normal Doc? And we will see you guys next time.